This is a front and back view of the knee joint demonstrating the normal cartilage, which is a smooth, nearly frictionless surface coating the ends of the bones. As arthritis ensues, there is damage to this cartilage, resulting in increased wear and friction, with secondary inflammation, bone spurs, pain, and occasionally instability. Low-impact exercises that maintain flexibility and strength of the muscles around the knee may help to partially compensate for this process and improve symptoms of pain and instability. When mobility is limited because of arthritis, it is easy to perform hamstring stretches with one leg on the bed and one leg off the bed, as this. With the leg to be stretched in front of you, reach down and try and grab your ankles or toes. You should feel the stretching behind the knee and into the back of the thigh. This should be held for 30 seconds and be performed twice daily. Isometric quadriceps exercises may be performed seated or reclined on a bed, and it is helpful to put a towel behind the knee. While sitting, try and straighten the leg all the way so that you feel the quadriceps muscle contracting in the front of the thigh. This should be held for 5 seconds and then relaxed. This should be performed for 10 reps and be performed for 2 sets daily. The isometric quadriceps strengthening exercise is performed lying down. With the leg to be strengthened, straighten the knee and lift the heel away from the ground. This should be held up in the air for 5 seconds and then relaxed. This should be repeated a total of 10 times and then do a total of 3 sets each. Seated leg extension exercises is performed with the legs hanging off the edge of a chair or a table or a bed. The leg is extended in front of you and held for 5 seconds. This is then allowed to relax to the resting position. This should be repeated 10 times and be performed for 2 sets daily. Standing hamstring curls are performed against a wall for balance. With the leg to be exercised, lift it off the ground, flexing the knee 90 degrees. This should be held for 5 seconds and then relax down to the resting position. This should then be repeated a total of 10 times for 2 sets daily. Heel slides are performed to maintain motion and coordination around the knee joint. While lying down on a bed on your back, take the heel and gently lift the knee up in the air, sliding the heel up. This should then be allowed to relax down to a flat position. This should be repeated for a total of 10 reps and then be performed for 2 sets daily.